So I thought I'd make a quick video about the logistics of testosterone. I'm trying to think about like what people would want to hear and what's interesting to people, and I have to remember that like while these videos may be watched by people that are trans, it's not just people that are trans, and then it's also people who have never been exposed to testosterone before in their life. So I want to like include a lot of details about it. I've got like a little list and everything, so I'm organized. Basically, so firstly, there are quite a few different forms of testosterone. There's injections, which is the most common one. That's usually like an injection once every 3 weeks. And then it's like, I think eventually you change the dosage and you go to like once every 3 months, or I think some people do that, and then you're on it for the rest of your life. So basically, it's called hormone replacement therapy. It replaces the estrogen in your body with testosterone, and of course, because we're not biologically male, we can't produce the testosterone by ourselves. So we have to continue to be on the testosterone for the rest of our life. Also, got a haircut. It's not a testosterone update, but it's a life update, and they're very important too. Um, all right, so the okay, right, sorry, injections. Right, there are other forms. I forget. Um, so there are injections. There are pills, but apparently they're not the best because they're really harsh on your liver because they're quite strong. Um, there's also patches, but I've heard that they're not great either because they can just kind of fall off. And then there's also gel. So I'm on gel currently. My original plan was to be on patches, and then I heard that they weren't going to be very good. I will be going on injections eventually. Injections is like the major goal. When I return home to Australia, that's what I'll be doing when I get there. But gel, from a logistical point of view, was just more practical while I'm overseas. Because, like, with the injections, you sort of need to see a doctor once every 3 weeks, or you need to just inject yourself. And, like, I don't know, it just didn't really work. I thought gel was probably better, easier to, like, manage. Also, the thing about injections, I don't know how true this is, but, it makes sense logically. But, when you take injections, you get 3 weeks of testosterone in like, one go. So I've heard that like emotional changes and things like that can be a bit more severe because you've got it all at once. Whereas what I'm on is just a daily dose, so every day I apply my gel. Um, and so obviously I don't think the changes would be as like intense or anything like that, but I'm not sure. Cool. All right. So the process of getting testosterone, I can only speak from my experience within Australia, within Melbourne, within the framework of the institutions that are set up there. Let's just say it's not easy. Like, it's really not easy, and you can't expect to get testosterone as soon as you come out and you're like, yeah, I'm ready. However, in saying that, I think that's good. I think it's good that it's not easy to get your hand on on like a dominant hormone that can completely change you. I think that's a good thing. It sucks, and I had to wait a long time, but it's good. The thing that I don't think is good is that within Australia, or within Victoria, I'm not sure if this is a general thing for all of Australia, but within Victoria, you can't actually get on testosterone under the age of 18. You can't sign informed consent when you're underage. And if you want to go on testosterone, you have to go to the family court, which is expensive and a long process, and I'm like very against it. But I think that like these sort of laws change quite frequently. Like they do change, and they are like modernized and updated and everything. So like there's always hope. There's always hope that like things will change, which is good. I was lucky in that I came out like April of the year that I was 17, so I had only until January to be 18 and to get on testosterone, which was really lucky. I was originally going to start testosterone much later because my family wanted me to wait until I came back from this trip in Israel and was able to like be around my family. Um, After a lot of like deliberation and a lot of thinking and a lot of soul searching, I chose against that. I decided that while I may not be with my biological family, I am with a family of people that support me and that are here for me and will do anything they can to be there. And I'm really glad I did that. And I think not going on testosterone when I did would have been a grave mistake. And now, like, my gender is just nothing. Like, it's not really an issue. Like, my dysphoria has subsided a ridiculous amount. Like, being on testosterone is not really a big deal because I've got so many other things going on. Like, as I mentioned in previous videos, like, I don't really look in the mirror, I don't really notice every little change. It sort of just pops up when I'm starting to be more, like, self-aware of my body, and then I'm just like, oh, cool, that's awesome. But I think if I was in Australia and I wasn't on a program and I was just living as I normally live, I would be so aware of everything and, like, so aware of how many weeks it's been that I've been on testosterone and things like that. Like, whereas now, I don't really have much of a concept of it. Like, I don't really know. So anyway, the process I went through, firstly, I had to go to my psychologist. I already had a psychologist. She was not a specialist in gender identity issues. She helped me through a lot of other issues that I was experiencing, but as far as gender went, I really did need a specialist. So I went to her. She wrote me a referral letter. I'm really lucky in that there's a clinic in Melbourne called the Gender Dysphoria Clinic that specialises just in this. Now, you can get on a waiting list and you can see a specialist for free, but that waiting list can take 6 months or more or less. I'm not really sure. It depends. Or you can just go through that clinic but say that you want to pay with private health insurance or with Medicare or whatever, and then they'll allow you to kind of skip the line and see someone quicker. So that's what I did. I was like, I need to do this. I really, really need to do this, and my mum was very supportive, and so was my dad. And yeah, so I did that. So I had to get a referral letter from my psychologist, from my general practitioner, from my doctor. I also wrote my own letter. Yeah, I had to write a letter about myself, my identity, like some history, things like that. I did that. I had to include 2 photos of myself, so I had that as well. Sent that all through. Harassed the shit out of that clinic, called them up every few weeks, like, where's my appointment, who do I call, what do I do? I think it was really useful that I was pushy, because I like, they're very, very busy. They have a lot of people to deal with, and I get that, and I respect that, but this was really serious, and I really needed to get to see someone as soon as possible. So I was very pushy, and I eventually got the number of, like, the psychiatrist that I would be seeing. He was the director of the Gender Dysphoria Clinic. He was the master of gender dysphoria in his field, the absolute master. His name is Dr. Finton Hart. I owe a lot to that man. I went and I saw him 6 sessions. Took a long time because they weren't 6 weeks, like, they weren't once a week, because he's a very, very busy man, as you can imagine. So they were spaced out over a long time. It took me, like, I don't know, it took me quite a few months. Like, I started seeing him in June, I believe, and I had my prescription for testosterone in December. So, yeah, it took a long time. I had to, eventually after basically the process was with him, he needed to just, like, ensure that I didn't have any other mental disabilities or any other conditions that would maybe present themselves as transgenderism. So he had to make sure I wasn't, like, schizophrenic or, had split personality disorder, things like that, because there have been issues in the past where someone has come thinking that they're transgender and that they're actually just, they have something else going on. So he did that. I was all good, got the all clear. Took a long time, and then he referred me to an endocrinologist, which is a hormone expert. He also referred me to an IVF specialist in case I wanted to freeze my eggs, because testosterone shrinks your ovaries, and it basically ends your menstrual cycle, so you can't produce eggs. However, after, like, speaking to her and speaking to my endocrinologist, speaking to a lot of people, I found out that I actually can come off testosterone when I'm ready to have kids for a few months, and my cycle will begin again, and then I can extract those eggs and have a child, hopefully. So we'll see how that goes. I'll, like, keep you updated in 10 years when I'm ready to have a kid. I'll, like, make a video about it, and then you'll know. But yeah, it was nice to not have to worry about that now, because at the time, for a 17-year-old to make decisions about whether he wanted biological children or not, that was pretty full on. And whether I wanted to spend $4,000 to freeze them when I didn't even know if I would use them, like, that was a full-on decision. And, like, I think that I was capable of making a few life decisions, and that was just not one of them. Like, I was not at a point in my life where I could make that. So it was good. It like put my mind at ease a lot. Seeing the endocrinologist was great. Like he was just so chilled out. Like I was like, this is the biggest deal in the world for me, and he was just like, yeah, it's fine. Testosterone's cool, whatever. Like it was just really chilled. He wrote me a prescription. I went to the chemist. Actually, I got a family friend to get it for me because he's a he works at a chemist, and so I got my testosterone a bit cheaper. As far as cost goes, I'm really lucky because I have a donation page, and I've been able to raise about $750 from that, which has been an unbelievable stress off my back, and like just it's been amazing. I really appreciated all the support that I received. There's a lot more expenses that are coming my way though, and I always appreciate any more support. But like, yeah, it's been really great. As far as testosterone goes, basically, okay, this is the deal, which is fucking, like, alright, it makes me angry, but I have to just, whatever. The deal is, testosterone is, covered by Medicare. Medicare, for those of you who don't know, is the public health system in Australia. It's great. We're really, really good that way. It covers, like, a few of my surgeries and stuff, so you do get to claim and you do get some money back on that, which is really, really cool. But basically, it covers testosterone only for males, because like it doesn't make sense why a female or someone legally registered as female would want testosterone. Like it doesn't make sense. So it covers it for males, right? Unfortunately, I am not male in the eyes of Australia or Victoria. I have not had any surgeries, and in Victoria you can't change your gender until you've had a bottom surgery, actually. So until you've had your ovaries removed or your genital reconstruction or something like that. Which is, like, absolutely insane. But whatever. So I went, happy to spend a fortune on my testosterone. My gel, each box, costs about $95, I believe. So I bought 9 of them. So I spent a lot of money. I spent more than what was raised on my donation page. However, I worked really, really hard when I finished school. I earned a lot of money, and I was like more than happy to spend that. If I was going to spend it on anything, this was the most appropriate thing to spend it on. So I was happy to do that, and it was fine. After I spent all the money, and after I got all my testosterone, I found out that Medicare had recently changed its laws in that you can change your gender with Medicare even if your gender was not legally changed. So I could have walked into Medicare with a letter from my psychiatrist and said, here, I'm transgender, put me down in your books as male. They would have done that, and then they would have covered my testosterone. It would have ended up costing me $6 a box. $6, as opposed to $95. I've dealt with it, I've moved on, it's fine, whatever. I'll never make that mistake again. And when I come home and I start my testosterone in a different form, I will be registered as male on Medicare. And it's fine, whatever. I'm coping with it, I'm dealing with it in my own way. Anyway, okay, cool. So, the general changes over time on testosterone, there are like big pros, there are massive cons. It's a very serious decision. It's not something that people just wake up one day and say, oh, I really want some testosterone in my body. That'd be really cool. Or like, I want to get bigger muscles, or I want to do this. Like, this is a cool steroid to go on. Like, it's really not like that. Basically, the positive effects is facial hair. That takes a bit of time, as you can see. Facial hair, let me think of everything. Facial hair, muscle growth, you get fat redistribution because men have like most of their fat in their abdomen, whereas women have it in their upper thighs and their bum and their hips. So it eventually redistributes to give you a more male shape, like a more V shape rather than an hourglass figure. What else? That stuff, more hair everywhere, stomach, legs, chest, all of that. What else? Jesus. There are lots of things. Horniness is a big one. I don't know if that's a positive one so much, but that happens. There's also clitoris growth. Your clit grows on T. Not a significant amount that it would like be big enough to be a penis, but it grows like a few inches, maybe like that. I don't know. Depends. It depends on the person. Sometimes it can be quite big, sometimes not at all. You end up getting erections because yeah, your clit gets erect when you're turned on anyway, but obviously when it's grown, it's like more prominent and you can tell better. What else? Other ones, eventually you get a bit of a receding hairline. You can experience male pattern baldness if that's in your family and your genetics. It is in mine. We'll see how that works out. I'm going to try like any medication I can to not have that. What else? You also have like a much higher risk of things like diabetes and heart disease, but just as much as any other male would, because men are more inclined to get that. You have a lower life expectancy, just as any other male would. Menstruation stops, ovaries shrink. There's not like many facts about this, but over time it's possible that testosterone can give you a higher risk of cervical cancer or ovarian cancer. But yeah, so that's why a lot of guys get their ovaries removed, because they also don't want to have to visit a gynecologist for the rest of their life. I would only do that after having children. What else? Yeah, so those are kind of like the general things. I didn't cover everything. I just kind of the ones that I think are important to know, stuff like that. At the end of the day, like if you really, really need testosterone in order to live, the cons are not really anything. Like you just something you have to deal with. What else? All right. So my testosterone. I'll show you. I'll put it on because I haven't put it on today yet. It's already 11 o'clock, and normally I put it on at 8 o'clock, but I slept in, and that's okay. This is my box of testosterone. One box equals 2 months worth. It's got in the box, let's see if I can open it. This is a new box, so it's not opened. That was probably stupid. I probably should have gotten one that was open. Basically, you've got a bunch of sachets, like lots and lots, like this. You've got 30 of these per box. Now, I'm currently on a half dose, which means I have half a sachet a day. So as you can see, this is my sachet right now. I use a little paper clip because that sort of divides it well and means that it doesn't like spread more. So I use half of this a day. I'm on a half dose because it regulates your body to be more used to testosterone before you go on a full dose. I'll be on this for another 3 months or so, or 2 months or so, something like that, and then I start a full dose, which is just a full packet. According to my endocrinologist, being on a half dose is not supposed to change much at all. It's supposed to have very, very minimal changes. I think I've experienced quite a few. So if I've experienced quite a few on half, I'm like really excited to see what a full dose will do. So yeah, so that that's pretty much it. It's like 5 grams of testosterone per sachet, I believe. Yep. So that means I take 2.5. Supposed to apply it in the morning, preferably, they say. The instructions said put it on your shoulders, stomach, or upper arms. I usually put it on my stomach. I've heard that it like gives a more concentrated absorption into the bloodstream. Today I'll just put it on my arms because I don't really want to like take my shirt off and do that on camera. It's not really my style. And yeah, like basically the goal is just to put it anywhere where it won't really contact other people, because you don't want to be like rubbing your testosterone against people who don't want testosterone in their body, or really anyone. So also you can't shower for 6 hours after, which can be really annoying. A couple times I've showered like a few hours after and just gotten out of the shower and just be like, fuck. Just because obviously like it can wash away some of the testosterone and then it might not get absorbed. Today I just had a shower in the morning. I try to have a shower in the morning before I apply my testosterone. Sometimes, like if I go for a run in the afternoon or whatever, I'll just leave it till later. Sometimes I have to shower twice a day, whatever. So I usually put it on at 8, and usually shower again at 2. Now it's 11, it'll take a lot longer, but it's fine because I already showered. So yeah, what do I do? This is how I do it. I don't know if this is interesting, but I thought this was interesting when I was starting because I wanted to see how people did it. So basically just like squeeze a bit on my hand, not all at once. I don't really do it on my arms very often. I don't know. It's funny because like I've got the most hair on my stomach now than any other place, like from testosterone. So I sort of feel like applying my testosterone directly to my stomach has like given me more hair there or something. Yeah, it's really annoying to be on a half dose just because it's like in one sachet and it's like not really divided properly. It's divided by like a paper clip, so sometimes it like leaks if I go on hikes or whatever. Like when I went on a hike and I was camping, it leaked, and that was really shit. So I sort of went a day without testosterone. Like I kind of got a bit out of the packet, but like not enough. Um, for those of you who are sitting there wondering, what happens if you miss a day of testosterone? Nothing happens. It's like shitty. You're not going to feel good about it. Nothing happens. It's fine. They just say like the instructions says if that happens, just to apply again the next day at the same time. Like obviously, don't do a double dose. It's the same with like birth control or anything like that. Like that would just be really stupid. So you just do it the next day. If you miss like a whole week or whatever, like again, nothing's gonna happen, but some of your changes might revert. So like there are certain changes on testosterone which are irreversible, such as like voice deepening. I forgot to mention that one as well. Voice deepening and like Adam's apple growth and stuff like that. Your facial hair will stop growing though. Your menstrual cycle will start again. Your fat will redistribute again if you stop testosterone. So like there are things that are reversible. There are also things that aren't. To me, I don't really care about the difference between them because I don't plan on coming off testosterone anytime soon. Um, so yeah, that's pretty much it. Am I done? I don't know. I've seen guys who like use the gel that get really into it and like I don't know, they cut the packet open when they're done to make sure they get every last bit. I'm not really that fussed about it. I figure like a tiny little bit of gel is not going to make much of a difference. So I sort of just put it on until it's done. That's pretty much empty now. I'm sure that there's some in there, but who cares? So yeah, just rub it in. You want to make sure your skin is dry. You also want to wash your hands afterwards because you don't want to shake someone's hand with testosterone all over you. Sometimes I'm shit about it and I just don't wash my hands for a while because like then there's more to be absorbed into my skin, but I make sure that I don't touch anybody. That's important. So yeah, that's it. I'm not sure if I addressed everything. I tried to do it. I'm doing this based off like no questions or anything. So if people do have more specific questions, send them out to me. I'm sorry that the video is so long. I just wanted to get everything in there. And yeah, I hope that was informative and let me know any feedback and yeah, have a great day.